So people regularly ask me, what is carpal tunnel syndrome and why am I having problems in my wrist? So today I'm going to look to answer that. My name is Dr. Gregg Gerstin, and I help people to remove the blockages in their health so they can lead amazing, fantastic lives. If you'd like to learn more about it, go ahead and subscribe to our channel because I am constantly creating videos to help you understand what's going on with your health in your life and how to make sure that you're living your best. So carpal tunnel syndrome has to do with some inflammation of what's called the carpal tunnel. So the carpal tunnel is a little bit of a tunnel that's created here in the wrist. It's created by the bones in your wrist and a ligament that winds up creating the arch. So there's 4 bones across right here in the wrist, 2 layers of them, and this carpal tunnel, or this tunnel, is created by a ligament that arcs it. Inside that tunnel, there are nerves and arteries that wind up flowing to supply strength and energy to the hand and nutrients to the hand. Through activities, that tunnel and the ligaments can get inflamed. Okay, and as they get inflamed, the tunnel gets congested, just like traffic on the tunnels that you may take. What happens to it is it winds up causing weakness, numbness, tingling to the hand. And if it's left alone, it can really be miserable. One of the challenges with carpal tunnel is actually determining where the compression and irritation is. Because just like there can be problems with flow coming out of a tunnel inside the tunnel, there also can be problems with flow upstream on how the energy gets out to the hand or carpal tunnel. So we've always got to be sure we're looking upstream at the elbow, the shoulder, as well as the cervical spine to find the cause of the problem. If you've got problems with carpal tunnel on both sides, you need to look upstream to both on where they connect to figure out the cause of the problem. And that usually takes us to the cervical spine or neck. If you or someone you know has been going through carpal tunnel, make sure that they're working with someone who's evaluating the whole entire chain and not just looking at their wrist. We've seen so many patients who have had unnecessary carpal tunnel surgeries that could have been avoided by taking care of the cause of the problem. If you've got questions or you'd like to see about finding someone near you that can do this, go ahead and write down below where you may be, and we'll look to see about finding someone who can support you. Once again, my name is Dr. Gregg Gerstin, and thank you for letting me be a part of your health.